Hello, I'm Stephen McCulley. I'm a consultant reconstructive and aesthetic surgeon, and I'd like to talk to you a little bit about breast reduction surgery. That's obviously an operation that makes the breast smaller, but it also makes it perch and more uplifted on the chest wall. It's a highly successful operation in that it addresses both cosmetic concerns for the patients, but also symptoms like backache, neckache, shoulder strap problems, uncomfortableness with the heaviness of the breast or clothes, and skin problems. Now, the operation can be done in different ways, but it shares common principles. That is, that the nipple is kept alive and lifted up on a tongue of tissue, and then the excess skin and breast tissue is removed, so for leaving the uplifted breast with a more pert nipple. Now, the main two techniques that are used, although there are numerous techniques, leaves an anchor-shaped scar, so a scar around the nipple, down and underneath. However, there is also the short scar technique, or the vertical technique, which leaves a scar around the nipple and down. Both of those can be excellent for the chosen patient, but the short scar technique is less good at removing a lot of skin and a lot of breast tissue, and therefore is less suitable for the really large breasted patient. The operation itself takes, in my hands, about 2 hours. It is a relatively quick recovery for most patients. You'd be in hospital for 1 night, usually without any drains, but sometimes you do. All your stitches will be inside and dissolvable, and I use a glue dressing on the outside so that you can shower the next day. Now, I say the recovery is quick. You'd still want the equivalent of 2 weeks off work, and for some patients, particularly in very manual jobs or standing up all day, you might want a little bit longer. The operation tends to, as I say, give a good recovery, but there are occasionally problems. Those can include wound healing problems, infection, altered sensation, be it on the nipple or the skin, very rarely actual loss or problems with the nipple itself. The scars will settle extremely well, but it will take 6 to 12 months to do that, and occasionally you can get some slightly thicker scarring, but that will depend on the patient. The operation otherwise tends to give very reliable, good symmetrical results, although again, occasionally you can see slight differences between the two sides. Although I regard this as a fairly routine operation, it is very important whether you come to myself or you choose another reputable surgeon, because this is still an operation that can cause problems if it's not done correctly. Anyway, whether you decide to come to see myself or choose another reputable surgeon near you, I wish you well with your breast reduction.